What if, what if a dog's greatest strength, like its unbreakable, stoic courage, is actually the exact thing that could put its life in danger?
Oh, absolutely. I mean, it is the most complex puzzle in dog ownership.
Right, because today we are decoding this ultimate canine paradox. Let's say you're out for a walk with your dog. Let's say it's a Bull Terrier, right?
Sure.
Out of nowhere, she does this little skip on her back leg. Just one skip, maybe for a couple of strides, and then she goes right back to trotting along like absolutely nothing happened.
Just completely ignores it.
Exactly. Or, later that evening, you're playing fetch, and she just decides to quit a few minutes earlier than usual. She lies down, breathes a little heavier, and that's it.
Yeah, and as an owner, you're looking at this animal and wondering, is that nothing? Or is that a subtle biological alarm bell?
So what does this all mean? Welcome to today's custom deep dive. We've got a stack of veterinary and care notes on Bull Terrier Health today.
And our mission here isn't to terrify you, with a laundry list of everything that could possibly go wrong.
Right. No hypochondria today. We want to extract the real, practical skill of ownership. We are trying to spot patterns across a stoic, incredibly physically confident animal that will happily hide its pain.
Yeah, how do you decode the hidden symptoms of a dog whose very personality is designed to mask weakness? We really have to start by completely discarding how we usually evaluate distress.
Discard it entirely.
Pretty much. A dog with this specific genetic wiring, I mean, this level of determination, is going to keep participating in normal life even when their internal systems are struggling.
Because their drive just overrides their discomfort. I kind of look at it like watching a highly competitive human athlete.
Oh, that's a great way to put it.
Like the kind of player who sprains an ankle in the first quarter, but because the adrenaline is pumping, they just tape it up and keep running.
Right, the neurological reward of the game is so high.
Exactly. And you wouldn't look at that athlete sprinting down the field and conclude their ankle must be structurally perfect.
Yeah,
Yet we do exactly that with our dogs.
we really do. We rely on the dog to behaviorally tell us they are hurt.
Which, with this breed, is a deeply flawed strategy.
Mm.
I mean, enthusiasm does not equal cardiovascular or structural health.
It doesn't. The dog's enthusiasm is a constant. And if enthusiasm is a constant, it's mathematically useless as a diagnostic metric.
We're basically flying blind if we rely on
Get
it.
totally blind. This is why we have to anchor our entire approach on the concept of the baseline.
The baseline, right. Because spotting a massive, dramatic crisis is effortless.
Yeah, anyone can see when a dog collapses. But the true skill is intimately knowing your dog's normal respiratory rate, their normal walking gait, their precise recovery times.
You aren't looking for the crisis. You are looking for the delta, the deviation from their specific baseline.
Exactly.
And that baseline concept is crucial, especially when we consider that some of this dog's most critical systems are essentially invisible to the naked eye.
Completely invisible. You can't see a structural failure happening inside an ear or a heart just by looking at a dog panting happily in your kitchen.
Right. And I know hearing and heart health are two of the four core screening areas for this breed, but they are notoriously difficult to test accurately at home.
They are, and the biology behind why they fail is just fascinating. Let's examine hearing first.
Let's do it.
So, Bull Terriers can be born with congenital hearing loss in one ear, or both. And while white coats deserve particular attention here, color isn't a definitive rule.
Plenty of white Bull Terriers here perfectly, right?
Right, and colored dogs aren't automatically exempt either.
Okay, wait, let's unpack this for a second, because I read that note in the source material, and it really bothered me. Why the white coat? Like, what does fur pigment have to do with the mechanical function of an inner ear?
It's crazy, right? It all comes down to cellular biology during embryonic development. The cells that produce pigment, melanocytes, they don't just color the fur
Okay, so where else are they?
in the inner ear, specifically in a structure called the stria vascularis. These same pigment-producing cells are responsible for maintaining a critical potassium gradient.
A potassium gradient.
Yeah. Without melanocytes in that specific part of the ear, the fluid lacks the electrical charge needed to translate sound waves into nerve impulses.
Wow. So the microscopic hair cells just die off.
Exactly. No pigment cells, no electrical signal to the brain.
That is incredible. It's an electrical failure, not just a structural one.
Yeah.
But here is where I get confused about at-home testing.
Oh, the pan drop test.
Yeah. Why is it so hard to figure out if your dog has this electrical failure in one ear? Like, why can't I just wait until the dog is facing the other way, drop a heavy frying pan on the floor, or clap my hands really loudly behind their head?
Right, and the logic being if they flinch or turn around, the circuitry works.
Exactly. Why doesn't that work?
What's fascinating here is how effectively the canine brain compensates for a sensory deficit. A dog with hearing in just one ear has a biological imperative to mask that vulnerability.
So they're hiding it on purpose?
Biologically, yes. If you drop a pan, they aren't merely listening for acoustic waves, they are feeling the percussive vibration of that pan hitting the floorboards.
Through their paws.
Yep, through the mechanoreceptors and their paw pads. They are catching subtle shifts in air pressure. They are watching how your eyes move when you drop it.
Oh, wow. So they synthesize all this environmental data so rapidly that a simple clap test is practically useless.
Completely useless for isolating the function of an individual ear.
They're essentially running a sensory workaround to trick you into thinking they heard the noise perfectly.
Precisely. Which leaves the owner with a totally false sense of security,
Right.
which is why the only truly objective method is the BAER test. Brainstem Auditory Evoked Response.
How does that work?
It places tiny sensors on the dog's head and measures the brain's actual electrical response to clicks played in each ear separately. It bypasses the dog's compensatory behaviors entirely.
That makes total sense. And the sources say it's crucial to differentiate between congenital deafness, which is that lack of melanocytes, and a sudden hearing change later in life.
Yes, because an adult dog suddenly losing their hearing isn't an embryonic pigment issue catching up with them.
Right, the anatomy was already built and functioning fine.
Correct. Sudden hearing loss later in life requires immediate veterinary intervention. You're now dealing with pathology, severe ear infections, a ruptured tympanic membrane, or even neurological toxicity from a medication.
Okay, so if the ears are masking their deficits through sensory workarounds, the heart is hiding its issues through sheer physiological reserve.
Absolutely. The heart is a master at this.
The sources mention that vets listen for heart murmurs, but they strongly emphasize that a murmur is a finding, not a diagnosis.
That is a fundamental distinction in veterinary cardiology. A murmur isn't a disease itself. It is just the acoustic feedback of turbulent blood flow.
Can you give me an analogy for that?
Sure, imagine a garden hose. If the water flows smoothly, it's silent. If you kink the hose, or if a valve inside the hose doesn't close tightly, the water sprays backwards and creates a vibration.
And that vibration is the murmur.
Exactly. Some dogs have mild, functional murmurs their entire lives with zero impact on their heart's pumping efficiency.
But the reverse must also be true, right? I mean, you could have a heart that is structurally failing. Maybe the muscle walls are thinning out and getting weak.
Right.
But because the valves are technically closing correctly, there is no turbulent flow. There is no kink in the hose. So there is no murmur for the vet to hear on a routine exam.
That is the exact danger. Severe cardiomyopathies can exist silently without a murmur until the heart is in a state of advanced failure.
So again, relying on a single binary test, like murmur or no murmur, leaves us totally exposed.
Completely.
If enthusiasm doesn't prove heart health, and a stethoscope might miss a failing muscle, what biological markers should we actually be tracking for that baseline?
You measure the hemodynamics through recovery time. If your dog normally bounces back from a vigorous 20-minute sprint in 5 minutes, but over the course of a few months you observe it's taking 20 minutes for her respiratory rate to settle, that is your delta.
Because the heart is struggling to oxygenate the tissue efficiently.
Exactly. Unexpected fatigue, a persistent dry cough, which is often the enlarged heart physically pressing against the trachea, or sudden fainting spells. These are the subtle indicators.
But context matters too, right?
Oh, paramount. A lethargic dog on a humid 90-degree day is just normal physiology regulating heat. We're looking for a sustained contextual shift.
Okay, so if the heart and hearing are masters of total invisibility, other biological systems act like, well, intermittent tricksters.
Oh, they totally gaslight the owner.
Yes, the kidneys and the knees fall right into this category. Let's look at renal function first. How exactly do the organs are literally operating on a fraction of their capacity before the chemical alarms even go off? That is terrifying.
It is. The notes mention protein in the urine as an early clue, but you aren't running a urinalysis in your kitchen every morning.
Definitely not. So what is the outward behavioral trick here?
The behavioral shift is in their water intake and urine output, but it happens gradually. As the kidneys lose their ability to concentrate urine, they start dumping excessive amounts of dilute fluid.
So to avoid dehydration, the dog just has to drink more.
Exactly. The operative word to watch for is persistent. A dog draining a water bowl after eating salty treats is a localized event. A dog whose daily water intake has demonstrably doubled over the course of 4 weeks, that is exhibiting compensatory survival behavior.
I really want to highlight a massive crucial rule from the sources here, which is never restrict a dog's water without direct veterinary orders.
Never.
Because if a dog is suddenly drinking constantly and having accidents on your expensive rug, human instinct says, well, just pick up the water bowl at 8 p.m.
Right, you think it's a training issue.
But if their kidneys are failing, you aren't solving a behavioral issue. You are actively suffocating their system, right?
It is incredibly dangerous. The dog isn't drinking to be a nuisance. They are frantically drinking to flush toxic waste products like blood urea nitrogen from their bloodstream because the kidneys can no longer filter them efficiently.
And if you restrict that water,
Those toxins build up instantly. You can push a chronically struggling dog into acute, fatal renal failure overnight. Always provide fresh water and let diagnostics tell you why they are thirsty.
wow.
Huh?
Okay, that brings us to the other major trickster, the knees, specifically patellar luxation.
Ah, yes, the vanishing skip.
This brings us right back to our opening scenario. The dog is trotting, does a little skip on the back leg, and then goes right back to normal. What is the actual biomechanical failure happening in that joint?
Think of the knee joint as a train on a set of tracks. The kneecap, the patella, is the train, and it's supposed to glide smoothly up and down inside a deep groove at the base of the femur.
Okay, tracking perfectly.
Right. But in dogs with patellar luxation, that groove is structurally too shallow. So when they turn or jump, the kneecap literally derails. It slips out of the groove.
And when it's dislocated, the dog mechanically cannot extend the leg to bear weight.
Exactly. So they pull it up into that hopping motion.
Here's where it gets really interesting, though. Because it's a mechanical derailment, the simple motion of taking another step or extending the leg often pulls the kneecap right back onto the track.
Hop right back in.
And the symptom vanishes. The skip disappears almost as fast as it started. And as an owner, the trickster element wins. You dismiss it.
You assume she just stepped on a thorn or, slipped on a wet patch of grass.
Right, but that's a trap.
A huge trap. The human brain wants to categorize fleeting symptoms as anomalies, but repeated mechanical derailments cause massive internal damage. Every time that bone slips in and out of a shallow groove, it scrapes away the protective cartilage.
And over time, that friction triggers severe osteoarthritis. And the absolute worst thing you can do is try to manipulate the leg to see if it happens again.
Oh, please do not do that.
You have owners playing amateur orthopedist, pushing on the joint, trying to recreate a deeply painful biomechanical failure. Don't do that. The sources emphasize pulling out your phone instead.
Yes. Video is your best friend.
If you notice a weird gait, record a video. Handing your vet a clear video of the exact mechanical breakdown is infinitely more valuable than trying to verbally describe a 3-second skip from last Tuesday.
The video provides objective data, and while we are discussing biomechanics, we really must address body mass. Extra adipose tissue, fat, is not inert. It acts as an inflammatory organ, and physically, it adds an exponential load to every joint.
So keeping a dog lean doesn't change the genetic depth of their joint groove, but it drastically reduces the daily friction.
Drastically. However, we also have to recognize that not every hop is a luxating patella. A dog could be favoring a leg due to a spinal compression, a torn cruciate ligament, or a fractured toe. Diagnostic imaging is required to separate the tricksters from the straightforward injuries.
This naturally leads us into what I call the visible traps: skin, teeth, and pica, which is swallowing objects. I call them traps because a symptom being highly visible does not make it easier to treat.
Often it makes it harder.
Right. In fact, visibility often drives owners into an absolute panic, causing them to actively sabotage the dog's biology.
The skin is a prime example of this trap, particularly with the short white coats prevalent in Bull Terriers. That lack of pigmentation doesn't just mean you can see every red hive and scratch. It means the epidermal barrier is uniquely vulnerable to environmental radiation.
Sunburn. White dogs get sunburned just like humans, which increases their risk for squamous cell carcinoma.
Yeah.
But the trap here is that owners think they can just grab human SPF 50 spray off the bathroom counter and coat the dog's nose in it.
Which introduces a completely new toxicological threat. Human sunscreens often contain zinc oxide or salicylates.
And a dog is going to immediately lick that lotion off their nose.
Without a doubt. And ingesting zinc oxide causes severe hemolytic anemia. It literally destroys their red blood cells. You are trading a UV risk for a systemic poison.
So you must use veterinary-approved products designed to be safely ingested in small quantities.
Exactly.
I see the same trap with itchy skin. The owner sees the dog chewing its paws raw, sleep is disrupted, and the owner goes into overdrive. It turns into a terrible, chaotic science experiment.
Oh, the kitchen sink approach.
Yes. On Monday, they panic and change the dog's kibble. On Wednesday, they switch to a medicated oatmeal shampoo.
Right.
On Friday, they dump a bunch of fish oil into the bowl.
Oh, it's a mess.
By Sunday, if the dog is slightly less itchy, they have absolutely no idea what actually altered the biological response because they changed every single variable simultaneously.
It obliterates any chance of isolating the antigen. You muddy the diagnostic waters completely. True dietary elimination trials to determine food allergies are strictly controlled, multi-week physiological resets using hydrolyzed proteins.
They look nothing like impulsively swapping a bag of food at the pet store.
Not at all. Furthermore, reaching for human anti-itch creams or leftover prescription medications can severely compromise the local immune system.
That leftover medication warning is huge, especially for eyes. The notes explicitly warn against using old steroid eye drops if your dog suddenly has a cloudy eye or starts squinting.
It's so common, but so dangerous.
I used to think, well, it's an eye drop, it reduces inflammation, it can't hurt. But the biology there is wild. If the dog has a tiny scratch on their cornea, like a corneal ulcer, and you put a steroid drop in there, it suppresses the local immune response and entirely halts the healing process.
Yep. That ulcer can rapidly melt right through the eye, causing the globe to rupture.
You are chemically suppressing the exact cellular mechanisms trying to save the eye. You cannot play doctor with specialized tissue.
Absolutely not.
Let's move to the mouth, which houses a massive biological illusion. Bull Terriers have these incredibly powerful, blocky jaws. They look structurally invincible.
They look invincible, and they certainly use them as if they are. But a high bite force does not equate to indestructible enamel.
So the strength is actually a liability.
In a way, yes. When they bear down on a hard nylon toy or a bone, they generate enough force to easily shear off a slab of their own tooth, exposing the sensitive pulp cavity.
Ouch.
Right. And here's where the stoicism, that baseline personality, becomes a trap. A dog will routinely eat dry kibble right through the agonizing pain of an exposed nerve or a root abscess.
Because in their minds, showing dental pain is a sign of weakness, and eating is a survival imperative.
Exactly. An owner thinks, well, he finished his bowl in 10 seconds, his teeth must be fine.
But you have to look for the subtle mechanical changes. Dropping pieces of food, suddenly chewing exclusively on the left side of their mouth, or suddenly losing interest in a tug-of-war game they used to dominate.
Which brings us to the most urgent visible trap. Kaget.
Swallowing things they shouldn't.
Right. This breed explores their environment tactilely through their mouths. The sources specifically highlight swallowed sock fragments, small rubber toys, and corn cobs as major obstruction risks.
A swallowed corn cob sounds almost comical until you understand the anatomy of a dog's gastrointestinal tract. It doesn't digest, and it's the exact perfect shape to lodge tightly in the intestines.
It acts as a complete mechanical plug. The intestines try to push it along through peristalsis, clamping down tightly on the rigid object.
Which cuts off blood flow.
Yes, leading to rapid necrosis, which is tissue death, and a fatal rupture within days. If you observe repeated unproductive vomiting and arched back indicating abdominal pain or straining to defecate, you are out of time.
And here's the golden rule, bolded and underlined in the notes. Never induce vomiting at home for an unknown object unless a vet explicitly guides you to.
People think hydrogen peroxide is a cure-all.
Right. You might think pouring hydrogen peroxide down their throat to make them throw up a sock is a smart, fast fix. But if they actually swallowed a battery, the corrosive acid will burn their esophagus on the way back up.
Or if they swallowed something sharp, the violent muscle contractions of vomiting can drive the sharp edge straight through their throat tissue.
You can turn a surgical retrieval into a fatal internal laceration. Just get in the car.
If we connect this to the bigger picture, you start to see a unified theme. Whether it's the heart, the knees, the skin, or the digestive tract, the dog's core genetic personality is constantly interacting with their pathology.
They mask the subtle failures.
They do, and then when visible symptoms finally breach the surface, our human instinct is often to misinterpret or mismanage them.
Which honestly can feel paralyzing. I don't want someone listening to this deep dive to become a hypervigilant hypochondriac hovering over their dog with a clipboard every time the dog sighs.
No, that's no way to live.
We need to synthesize this data. How do we build a practical, everyday framework for monitoring these hidden systems without losing our minds?
It requires integrating observations smoothly into your daily bonding routines. You do not need to conduct formal medical exams. You just need to be tactilely aware.
Like when you're petting them.
Exactly. When you are petting them on the couch, run your hands firmly over their ribs. Can you still feel the individual bones, or has their adipose tissue increased?
Checking their weight passively.
Right. When you wipe muddy paws, spread the toes and check the webbing for inflammation or cysts. When they pant, visually scan the gum line for heavy tartar. You are passively gathering baseline data.
That makes it so much more manageable. And the sources outline a brilliant 3 tiers of action framework to help you categorize that data. Tier 1 is the routine visit,
This is for slow, non-urgent changes.
like a mild recurring itch with no broken skin, a gradual buildup of plaque, a small, soft lump under the skin that hasn't changed size in months. You don't panic, you just document it and bring it up at their next scheduled checkup.
Perfect. Tier 2 is the prompt call. This requires action within the week. This encompasses the tricky symptoms we discussed. That vanishing knee skip, a sudden onset of eye redness or squinting, 2 days of soft stool, or a sustained measurable increase in their daily water intake.
You secure an appointment while the symptom is active.
Exactly. And finally, Tier 3, the emergency.
This means grab your keys, skip the phone call, and drive to the nearest open clinic immediately.
Severe respiratory distress, collapsing blue or pale gums indicating oxygen deprivation, major blunt force trauma, clustered seizures, or knowing for a fact they just swallowed something dangerous or toxic.
Internalizing those 3 tiers really neutralizes the panic response. You aren't obsessively monitoring every breath. You have simply trained yourself to recognize what normal looks like.
So when a biological symptom crosses from a Tier 1 into a Tier 2, you are prepared. You have the video of the gait abnormality on your phone. You have the timeline of their increased thirst. You can hand the veterinarian actionable, objective data.
The ultimate goal here isn't to look at this strong, clownish, incredibly entertaining animal and see a fragile piece of glass that's about to shatter. Their courage and their persistence are exactly what make them so incredible to live with.
They are amazing companions.
But that courage is a double-edged sword. It demands an owner who is educated enough to see through the bravado.
This raises an important question, and it's something I want to leave you to mull over. Throughout this deep dive, we have focused entirely on physiology, hearts, kidneys, biomechanics.
Right.
But think about the incredibly blurry boundary between personality and pathology. If your dog suddenly starts ignoring a training cue they've known for years, or they begin aggressively guarding a favorite toy, or they snap when you try to dry their paws,
Is that just classic terrier stubbornness emerging?
or is it actually a hidden medical route?
Wow. That completely shifts the paradigm. Is it a sudden attitude problem, or are they experiencing referred joint pain, early-stage hearing loss, or the neurological confusion of a systemic infection?
Exactly. It forces you to reevaluate every behavioral quirk through a physiological lens. The body and the brain do not exist in isolation.
That is a fascinating lens to look through the next time your dog decides to completely ignore you on a walk. So much of what we write off as just their personality might actually be biology desperately trying to communicate.
It's a game changer once you see it that way.
It really is. Thank you for joining us on this deep dive. Trust your baseline, watch for the delta, and we'll catch you next time.